Imaging exams from mammograms to MRIs are a huge benefit for patients looking to stay on top of their health. Now there's new technology that could make those exams even better and catch diseases faster. Fox 11 News In Depth starts right now. Welcome back to Fox 11 News In Depth. I'm Hal Eisner. Doctors count on medical imaging to detect tumors or other matters of concern while they are small and more easily treatable. But analyzing those images is time-consuming and puts a lot of pressure on radiologists. But RadNet has some new solutions using AI, artificial intelligence, to help spot abnormalities. In fact, in a recent study, one of those tools was shown to have potential to detect breast cancer 1 or 2 years earlier than currently known, and that's pretty remarkable. Joining us right now, Dr. Gregory Sorensen. He's the founder and CEO of DeepHealth, RadNet Incorporated. Doctor, good to see you. Thanks for joining us.
My pleasure. Thanks for having me on.
Thank you. We put a lot of faith in those screening tests we get, whether they're routine like mammograms or tests looking for evidence of a tumor. How accurate are they really on a general basis?
You know, Al, they're quite accurate. Screening tests are not brought to the general public until they go through rigorous testing that shows in prospective studies that patients do benefit from having these kinds of tests as a whole population. So that means the benefits outweigh the risks of having these kinds of screening studies. And that's certainly the case for mammography. It's also the case for colon cancer screening. And especially now, there's very good evidence that lung cancer screening is particularly beneficial for people who qualify. In the case of lung cancer screening, that's smokers and former smokers.
Tell us about what this new technology entails.
Yeah, you know, it's quite remarkable. The same mathematical equations that underlie Siri and Alexa, these tools that seem to be able to recognize patterns from data, are now being used in the same way to look at medical images, mammograms specifically, but other kinds of screening exams and images. And this has been a real breakthrough. Because I've been doing this now for many decades, and it's been a hard problem to get computers to really understand and recognize patterns in images. But these mathematical equations, this so-called deep learning, this has really changed the ability for software to help us physicians find these abnormalities.
You mentioned,
and as you said in your opening.
You mentioned.
Oh, go ahead.
You mentioned it's more than just for mammograms, but you know, the last couple of years dealing with COVID, a lot of people didn't do any of this stuff. They didn't want to get out in public.
Yes.
They didn't want to go anywhere. They didn't get the test. And people were showing up, according to interviews we did right here on this program, people were showing up at ERs with stage 4 cancer.
Yes, unfortunately, there's now emerging data that by missing these screening tests, people are showing up with later stage cancer. You know, it's easy to put off, but in fact, the data are very clear, and it's kind of an unfortunate natural experiment that COVID has done. Screening really does help us catch cancer earlier, and that does save lives.
And this new technology, how does this help patients?
Well, the main thing is it helps the test be more accurate. Because we have the AI to help us physicians, we catch the cancers more frequently, and we have fewer what we call false positives, few false alarms. And so that means fewer women are being asked to come back for, say, an ultrasound or an MRI, and more women are having their cancers found, as you said, 1 to 2 years earlier. It's a big win.
Where is this in use, and is it becoming more widespread?
It is. We've now rolled this out across more than 200 of the RadNet centers. It was just FDA approved in May, and a lot of data and effort went in for years and years to develop and test this. And we can see that whether you're an expert physician that does this full time, whether you're a part-time physician that reads mammograms, say, a couple of days a week, now all of those physicians are at expert level. It's really, I wouldn't want my own wife's mammogram to be read without AI. It really is making a big difference.
And just to sort of repeat a little territory we covered, this is not just for women, and it's not just for mammograms.
That's exactly right. We now have these tools that help us with other kinds of imaging. So, of course, there's a whole set of AI that helps us radiologists, us physicians, look at the pictures better. There's also a lot of technology around AI that's going into making the pictures. It helps the MRI go faster, so the exam doesn't last as long, for example. It helps the X-ray dose come down, so it's a safer exam. Even just the throughput of the patients and the workload that the technologists have to go through, all of this is being assisted by these artificial intelligence tools. It's really having a very positive impact in patient care.
I'm fascinated by AI. Just the whole idea of artificial intelligence is so science fiction to me. But number one, short definition of AI as you see it. Number two, where do you see all this going in the future?
Sure. So artificial intelligence today, of course, is a broad term. And what's really being used in medicine today is this form called deep learning, where we train the software on examples. So you can kind of think of it definitionally as like a really good memory. It learns from 10 or 100 lifetimes worth of images and consolidates that down into a single piece of software that can help us doctors. I call it bringing the best doctor in the world to every patient. It really distills years and years of learning, decades and decades of learning, by having this fantastic memory. And I think where this is going is we're going to have software products in the future that will start to read some of these images on their own. And you'll get a report back that says no further human review needed, because the machine does such a good job of identifying which needs further medical attention and which just come back next year for your screening in a year or whatever. And I think that will broaden access, make imaging and these screening tools available to a lot of people who, for today, it's harder. You know, many of us live in cities where we can go, but some people live remotely and it's hard for them to get follow-up. If we can kind of package this expertise into a software or piece of hardware that we can then deliver remotely or out in a rural area or even in other countries, it's going to have a big positive impact on cancer detection and cancer cure rates worldwide.
Fascinating. Just fascinating. Dr. Gregory Sorensen, thanks so much for joining us. Coming up next.